Rebecca. It's Jared, your nurse. How are you feeling after the surgery?
I'm okay.
You're okay. That's good to hear. Well, we're going to be starting a new medication. It's an anticoagulant. It's called warfarin, but it's more familiar as Coumadin. Have you heard of this medication before?
No, what does that do?
So this medication is basically a prophylactic medication, and that's going to help to prevent deep vein thrombosis, pulmonary embolism. It will prevent stroke, and those complications can occur just because you're immobile, but we're giving it to you just to make sure that we're not going to run into those complications. Is that okay?
Okay.
Doc, Joe Young.
Yes.
I have a few questions for you.
Yeah, what's up?
I have a patient on warfarin, and I just need to ask you a couple questions. Is that okay?
Yeah, sure. What's up?
So how does the medication affect the body?
Oh, you know what? Let me tell you about that. The medication affecting the body, that's called pharmacodynamics. All right, so let's see, I wrote a few things down. Pharmacodynamics, let's see, let me read the pages. Warfarin decreases the body's ability to form blood clots. Right? This is by reducing the synthesis of active clotting factors to 7, 9, and 10, which then this leads to prolonged clotting times. Right? So the blood is thinner; it takes a lot longer for the blood to clot. And then this is basically measured with the INR, which just stands for International Normalized Ratio. So this thereby prevents the thrombus formation. But hey, there's more stuff you should know. For example, pharmacokinetics, how the body affects the medication, right? So the body has multiple things, but mainly the liver. With the help of a lot of the enzymes and stuff, it can reduce its effect and create can inactivate it in the body. Its half-life is actually pretty long. It's 20 to 60 hours, actually. And you have to keep in mind a lot of things. For example, the genetics of the patient, the food that they eat, and how much medication you're giving it, so you can maintain a good clotting time, safe clotting times, okay? Safety is very important, okay? Also, let me tell you about the method of action, right? The method of action of this medication is basically a vitamin K antagonist that inhibits the enzyme vitamin K, which prevents the activation of vitamin K clotting factors, which is prothrombin. This leads to a delayed anticoagulant effect, requiring several days for full effect, okay? Warfarin requires monitoring, again, the INR, you wrote that down?
I did.
Okay, good. To maintain the effectiveness to reduce the bleeding risk, okay? So you have to keep in mind before you give more of this medication too, like what the INR is, okay?
Okay.
Okay, good. You got all that?
I did.
All
Thanks,
right.
Doc Zoyoung.
I got you.
Gotta run. All right, and I'm gonna give you your pain medication. This is aspirin.
Wait. What did you just give her?
Oh, her pain medication, aspirin.
No, you can't give any NSAID or other anticoagulants with warfarin because it increases her risk of bleeding.
I'm so sorry about that. We will have to change that.
Okay. Also, just so you know, other food interactions include vitamin K, like leafy greens, or other herbs that start with G, like garlic, ginkgo, or green tea, because that decreases the effect of warfarin, and also no alcohol consumption, because that increases the risk of bleeding. I'm thirsty. What is this? But that increases the risk of bleeding.
Hey, Sarah. I wanted to talk to you about earlier. Just please don't tell Doc Zoyoung. I look up to that man. He really is one of the greatest attending docs I've been with. And
Well,
I just don't want to let him down, you know?
According to 13B and page 57 of the handbook, I am obligated to tell the doctor of any near misses or medical.
Hey guys, I heard something. Want to tell me something? What's going on?
Oh, nothing. I mean, we just had a near miss, but the patient's doing fine.
Patient's doing
Patient
fine?
is stable.
Sure about that? Okay, good, because that's what matters, right?
Right.
You want the patient to be good. Hey, have y'all seen any excessive bleeding with the patient at all?
Nope.
None of that.
We've been on top of the nursing implications. Some of the things we've been looking out for is monitoring the INR.
Yeah.
Especially for our patients with chronic kidney disease.
Yeah.
We're also assessing for bleeding, whether that manifests itself in bruising, petechiae, external bleeding. And we're mindful that vitamin K is the antidote. So if any complications arise with this, we'll be sure to provide them with some vitamin K.
Okay.
And we're also monitoring what medications they're on just to make sure there's no complications associated with the drug interactions.
That's what we want. That's what we want. We don't want any excessive bleeding at all.
Yes, sir, Doc Zoyo.
But also keep in mind, other adverse effects other than the bleeding could be like nausea and vomiting. Okay? Has that been happening?
No.
Okay, good. But if it happens, I'll order you also some antiemetics. Okay.
Perfect.
Okay.
Also, just remember, like any risk with pregnancy, you don't want to give warfarin with it because it'll increase the harm to the fetus. And then you also want to monitor the baby if she is breastfeeding for any bruising or bleeding.
On the baby?
On the baby.
Right. Yeah. Makes sense. Okay. Good, guys. Keep up the good work. And yeah, just page me if you need anything. Yeah.
Awesome. Thanks, Doc Zoyo.
I got you.
All right, that concludes my assessment. Heart sounds were sounding good. Do you have any other questions for me?
Yeah, is my new medication working?
That's a good question. As far as we know, the medication is working because number one, your INR is in therapeutic range, and number two, you're not showing any signs of external bleeding or manifestations of bleeding, and three, you don't have any deep vein thrombosis. There's no presence of pulmonary embolism, and you're not having a stroke, which is a good sign. All in all, the medication has been working great.
Okay, great. Thank you, Nurse Jared.
Awesome. I'll come check on you in a bit.
Okay, thank you.
All right, Sarah, your heart sounds good.
Thank
I think
you.
the doctor will be in to speak to you in a second.
Hi, Sarah.
Hey, Doc.
It's Doc Zoyoung, just coming in to check on you. How are you feeling this morning?
I feel a lot better since I got here.
That's good to hear.
But I have to tell you, I could not sleep last night, so I had to do some research on eliquis, and I found that it's an anticoagulant, which is used to help prevent blood clots like DVTs, PEs, and used for patients with atrial fibrillation. And it does so by preventing the conversion of prothrombin to thrombin, and it stops fibrin clot formation, therefore reducing blood clots.
That's very good. That's pretty much all you need to know about it. It blocks something called factor A, which is very prevalent in clot formation. And it's a medication we like to give for our AFib patients because it starts working pretty fast, within a few hours, and it usually lasts for a whole day. So it's very convenient. You can take it in the morning and your symptoms will be taken care of for that day. Your body removes it through your liver and your kidneys. And so I just like to start our patients off with some labs, some blood work, and just to assess the overall liver and kidney function, just to make sure we're not encountering any problems and we're effectively metabolizing and excreting the drug properly. And yeah, unlike other blood thinners, this drug doesn't require routine blood work and routine labs. So once we get all figured out and we're hitting that therapeutic level, we can send you on your way and you'll be able to take this medication to help you with your AFib.
Thanks, Doc.
Of course. Do you have any other questions?
No, that's good for me.
Awesome. Well, good to see you. Glad you're feeling better.
Thank you.
And I'll come check on you in a little bit, okay?
Sounds good.
Awesome. See ya.
So can you just tell me about some of the drugs that you can't take with eliquis?
Yeah, so it's going to be medications that affect the liver enzymes. Antifungal agents and proteinase inhibitors slow the effect of the drug. And NSAIDs affect platelet aggregation and antiplatelets such as aspirin.
All right, and then correct me if I'm wrong, but some of the food interactions would be like Jameson worts, which basically decreases the effectiveness of the drug, and then also your herbs like ginger, ginkgo, and all of those that increase your risk for bleeding, and then also alcohol increases the risk for bleeding, right?
Yes, that's correct.
Hi Sarah, how are you feeling?
I feel a little nauseous.
You are? Well, I know it's hard, but the medication is working. We haven't seen any new clots. But it is an expected side effect that you will feel a little nauseous or you may have a little bit of vomiting, but we can treat that with an antiemetic if you would like.
Oh yes, please. Thank you.
Okay, I'll go get the order for that. Alright.
Hey, did you check if Sarah's pregnant?
Yes, I checked this morning and her tests all came back negative, so she's not pregnant.
Okay, good, because it's contraindicated in pregnancy because eliquis may cross the placental barrier and increase risk of bleeding in the baby during delivery or labor. And in breastfeeding women, it is not known if the drug appears in human milk, so the patient should discontinue breastfeeding or the medication, considering the importance of it to the patient.
Hey guys, just wanted to pay you a visit. Just want to talk to you guys about some nursing implications. There was a hospital downtown. They got a major lawsuit because they weren't following up with these considerations. Big thing, we want to assess for bleeding, and that can manifest itself in bruising, external bleeding, petechiae, all kinds of symptoms. So we're gonna want to watch for that. Another big thing is enforcing patient teaching, because this is a drug that a lot of patients will be taking home with them. So it's important to make sure they know how to manage this medication. And then last thing is to administer andexilate alpha, because that is the antidote for this medication. In case there's any complications, that would be the thing you would give them. Other than that, I think you guys are doing a great job. We don't want to catch any lawsuits, so keep doing a good job. And yeah, thank you guys for doing your hard work. Okay?
Thank you.
I'll see you guys.
Thanks, doctor.
So for the spiritual connection with eliquis and warfarin, we know that they help prevent blood clots and improve our overall blood circulation. And this can remind us of the power of Christ's blood, which helps cleanse our bodies of sin.
Exactly. And just like blood clots prevent circulation, that's necessary for life, a heart full of sin breaks our connection with God. And so, a heart full of sin is like a body full of clots, does not function properly.